the most dangerous medications in the world. There are many drugs out there designed to make our lives easier. Prescription medications have helped create a world where we feel happier, healthier, and more comfortable, where many of our ailments can be treated and managed effectively. But these drugs are not always sunshine and daisies. We've assembled a list of some of the most dangerous prescription medications, drugs that have been linked to overdose deaths when misused. Don't worry. When taken exactly as prescribed and under proper medical supervision, these medications are generally safe to use. Let's take a closer look. Fentanyl. A synthetic opioid that's 100 times stronger than morphine or heroin, fentanyl is an extremely powerful drug. It has sometimes been found in marijuana and other substances that were unknowingly laced with it, increasing the risk of accidental overdose. Medically, fentanyl is used to treat moderate to severe pain, and it has also been used as an anesthetic for decades. However, because of its potency, fentanyl can be especially lethal when combined with other drugs such as cocaine or methamphetamines. Even small amounts can have devastating consequences. Meperidine. You may recognize this medication by its brand name, Demerol. It is a powerful pain reliever used to treat severe pain. Because of its effects on the body, patients are often cautioned about prolonged use, as it can lead to dependence. When mixed with alcohol or certain other drugs, the risks increase significantly. Blood pressure can drop, breathing can become dangerously suppressed, and in extreme cases, it can lead to loss of consciousness or coma. Like many strong medications, it must be used carefully and only under medical supervision. Clonazepam. Also known by the brand names Klonopin and Rivotril, clonazepam belongs to a class of medications called benzodiazepines. It is commonly prescribed to treat seizures and panic disorders. Because it produces feelings of calm and relaxation, it is sometimes misused. On its own and taken as prescribed, clonazepam is rarely fatal. However, the risk becomes far more serious when it is mixed with other drugs or alcohol, which can dangerously suppress breathing and brain function. As with all benzodiazepines, it must be used responsibly and under medical supervision. Morphine. Most people know morphine as a powerful medication used in hospitals to treat extreme pain. It is highly effective and plays a critical role in modern medicine. However, morphine also produces feelings of euphoria, and its withdrawal symptoms can be severe. Because of its potential for misuse and dependence, it is considered one of the more tightly regulated drugs in the pharmaceutical world. In the United States, medications are classified into 5 schedules based on their potential for abuse, ranging from Schedule 1 to Schedule 5. Schedule 1 carries the highest potential for abuse, while Schedule 5 carries the lowest. Morphine is classified as a Schedule 2 drug, meaning it has accepted medical uses but also a high potential for misuse and dependence. Alprazolam. Also known by its brand name Xanax, alprazolam is a potent benzodiazepine prescribed to treat insomnia and generalized anxiety disorder. However, it carries a high potential for misuse. Studies show that roughly 20% of people with anxiety disorders struggle with alprazolam abuse. Long-term use can lead to serious neurological problems, making it a medication that must be used carefully and strictly under medical supervision. Oxycodone. Oxycodone is the primary ingredient in medications like OxyContin and Percocet, drugs that are among the most commonly misused prescription painkillers. It is a powerful opioid used to treat moderate to severe pain. However, studies show that approximately 5 to 10% of patients prescribed oxycodone may develop an addiction. When combined with alcohol or other substances, the risks increase dramatically, potentially leading to severe complications, including lasting brain injury or death. Like other opioids, oxycodone must be used exactly as prescribed and under close medical supervision. Diazepam. Another benzodiazepine on this list, diazepam is more commonly known by the brand name Valium. It is prescribed to treat muscle spasms, anxiety, and certain seizure disorders. When taken as directed, it can be highly effective. However, recreational use or misuse significantly increases the risk of dangerous side effects. Long-term abuse of diazepam has been linked to sleep disturbances, cognitive impairment, and an increased risk of dementia. As with other benzodiazepines, careful medical supervision is essential to ensure safe use. Amphetamines. Amphetamines are a group of stimulant medications that include drugs such as Adderall. They are commonly prescribed to treat conditions like ADHD and narcolepsy. However, when used recreationally or taken in excessive amounts, amphetamines can cause serious side effects. These may include severe insomnia, significant loss of appetite, and dangerously elevated blood pressure. In more extreme cases, misuse can lead to intense anxiety, agitation, and even episodes of paranoia. As with all stimulant medications, proper medical supervision is critical to reduce the risk of harm. Acetaminophen. One of the most common pain relievers found in households today, acetaminophen is widely used to treat pain and reduce fever. It is commonly known by brand names such as Tylenol, and it is also an ingredient in combination medications like certain cold remedies and prescription painkillers. When taken in recommended doses, acetaminophen is generally safe and effective, with minimal side effects. However, in larger amounts, it can be extremely harmful. High doses can cause severe liver damage and, in extreme cases, can be fatal. Because it is so widely available, it's especially important to follow dosing instructions carefully and avoid exceeding the recommended limit. Sources: Avenues Recovery, FDA, Delamere Health, Rehab Spot. Ketamine. While ketamine is sometimes known as a recreational drug, it has long been used in the medical field as a powerful anesthetic. Because of the way it affects the brain, it can produce dissociative and hallucinogenic effects. In recent years, ketamine has also been used in certain medical settings to treat severe depression, as it can improve mood rapidly under controlled supervision. However, misuse or long-term abuse can lead to serious consequences, including memory impairment and dangerous breathing suppression in high doses. As with any powerful medication, ketamine must be administered carefully and only by trained medical professionals. Antidepressants. These medications are most commonly prescribed to treat major mood disorders, including depression. In some cases, they are also used to manage conditions such as OCD and ADHD. Because every individual responds differently, antidepressant treatment must be carefully tailored and monitored by a medical professional. When misused or taken in excessive amounts, antidepressants can cause serious side effects, including impaired coordination, extreme drowsiness, and in severe cases, loss of consciousness. Like all prescription medications, they are safest and most effective when used exactly as directed. Methamphetamines. More commonly known as meth, these powerful synthetic stimulant speeds up the central nervous system and triggers a surge of dopamine in the brain. Because of its intense effects, meth is highly addictive. Long-term abuse can cause dramatic physical changes, including rapid weight loss and severe dental damage. One of the major concerns for medical professionals is how accessible the ingredients can be in illicit settings, contributing to widespread misuse and a high risk of fatal overdose. Methamphetamine is a substance with devastating consequences when abused, posing serious risks to both physical and mental health. Codeine. Codeine is an opioid pain reliever that is chemically similar to morphine. It is used to treat mild to moderate pain and can also be found in certain prescription cough syrups, typically in lower doses. While effective when taken as directed, problems can arise when someone exceeds the prescribed amount, often in an attempt to relieve persistent pain. An overdose of codeine can cause serious symptoms, including slowed or difficult breathing, extreme drowsiness, and a bluish tint to the lips or skin due to lack of oxygen. As with all opioids, careful dosing and medical supervision are essential. Hydrocodone. Hydrocodone is another powerful medication used to treat chronic pain, and it is also found in some prescription cough suppressants. Because it is an opioid, it carries serious risks. Potential side effects can include damage to the liver or kidneys, along with impaired coordination and motor function. In cases of overdose, hydrocodone can severely suppress breathing, a life-threatening emergency that requires immediate medical attention. As with all opioid medications, it must be taken strictly as prescribed. Methylphenidate. Most commonly known by the brand name Ritalin, this medication is used to treat ADHD and narcolepsy. It has been shown to effectively increase focus, energy, and cognitive performance in individuals who need it. However, when misused or taken in excessive amounts, methylphenidate can have serious consequences. Reported effects of abuse include hallucinations, aggression, muscle pain, and in extreme cases, life-threatening complications. Like all stimulant medications, it must be used carefully and under proper medical supervision. These medications are not dangerous because they are bad. They are dangerous because they are powerful. When used responsibly, under medical guidance, they save millions of lives every year. Respect the dosage. Follow your doctor's instructions. And never mix medications without professional advice. Medicine can be life-changing, but only when used wisely. If you found this video helpful, don't forget to like, comment, and share it with your friends, and make sure to subscribe to the channel and hit the notification bell so you never miss our latest videos on health, medicine, and safety. Your support helps us create more content like this, so join our community today.